Good morning.
Morning.
And thank you for making time to be here with us today. My name is Dr. Gwendolyn Keita, and I'm the Executive Director of the Public Interest Directorate of the American Psychological Association. On behalf of the American Psychological Association, Workplace Flexibility 210, and the New America Foundation, it's my great pleasure to welcome you here today to this briefing entitled Supporting a Healthier Workplace, Workplace Flexibility and Mental Health and Wellness. I would like to take a moment to express our deep appreciation to Congressman David Lipinski for his help in securing this beautiful room for today's briefing, as well as to Representatives Grace Napolitano and Tim Murphy, co-chairs of the Congressional Mental Health Caucus, for their unwavering commitment and support of mental health issues and for their assistance with today's event. Not very long ago, work and family, two of the most important aspects of most of our lives, were almost totally separate. This may not have been considered a big problem years ago when the traditional family was viewed as one with men working outside the home and few women in the paid workforce. Now, I should note that this description of family did not fit a number of individuals even then. But today, almost half of the nation's women work outside of the home, 47% according to the U.S. Department of Labor for 2008. Likewise, today we recognize many different family constellations, including single-parent families, gay and lesbian families. So it is clear that separating work and family is no longer an option. The stress caused by work-family conflict has incredible costs to our health and psychological well-being, as well as that of our families. As we look at our nation's health, work-family balance must be included. A report by the National Institute for Occupational Safety and Health noted data suggesting that working time has increased dramatically in the last 2 decades for prime-age working couples, and workers in the United States now log more hours on the job than their counterparts in most other countries. These long hours of work not only add to worker stress, but also provide greater opportunity for work-family conflict. So again, the importance of the workplace and work-family balance as we address healthcare reform cannot be overemphasized. This morning, you will hear from a remarkable panel of experts. It's our hope that you will utilize the information that will be presented to inform your efforts on healthcare reform. This is an important time in our country, and we must work together to develop and promote policies that lead to a healthier work environment for all. I will now turn it over to Kathy Corrigan, Co-Director of Workplace Flexibility 210. Thank you.
Thank you so much, Dr. Keita, and it really is a pleasure to co-sponsor this event with the APA and the New America Foundation. I really liked on the announcement how you saw those 3 logos, which I have not ever seen together before, so I thought that was pretty cool. I'm really glad all of you have decided to join us this morning for what I think promises to be an interesting conversation, as Dr. Keita said, on 2 areas of public policy that obviously we think are pretty important. The topic for today's panel, workplace flexibility and mental health and wellness, is one of those issues that, at least to me, seems intuitively obvious. When I just think about my own life, yeah, you know, when I'm rushing to work and trying to get work done and trying to take care of my kids, that creates a whole lot of stress. Of course, Katie Corrigan's personal experience isn't really the standard that Washington policymakers should be using when they think about how to do policy in this arena. There's certainly a little more nuance to surface. But also, you'll really hear this morning from two researchers who have done the work to really surface the intersection of flexibility and health, and specifically looking at things like wellness, obviously relevant to the healthcare debate. But there's not just that problem of, Katie Corbin's personal experience isn't a good standard to use when making policy. You do want to look at the data. It's also, I think, one of those things where when you look at your own personal experience, or my personal experience, I think sometimes that individual frame, you lose the big picture. That when you look around at the data, and that's indeed what my shop has been doing for the last 5 years, this isn't just my problem, it's not just your problem. It's not just about one parent at one income level struggling with these issues. It's about a lot of parents and families. It's not just about one industry or one company facing major demographic shifts in the workforce. It's about all industries. And it's not just about one retiree trying to figure out how to phase retire, because it turns out they have to work a little longer than they'd expected. It's a whole lot of people. It's not just about one type of caregiving need of a small kid. It's about a constellation of caregiving needs and a constellation of caregivers. So when you look at this issue, again, in that individual frame of we can all identify, I just want to make sure we don't lose sight, and this is what Dr. Halpern and Dr. Gruwach will surface today. The real challenge for policymakers, I think, in this area is to connect the dots. Connect the dots between the different types of people who are impacted in different ways. Connect the dots between the different major policy discussions going on. In this case, on healthcare and in the area of labor and employment law. And then also, I think as you listen to folks today on the panel, thinking about the costs of not dealing with this problem. I think that one of the things today's briefing will do is make the connection between these two policy conversations, but it will also capture this kind of spillover effect for workers, communities, business, and families of that mismatch between work and life. And specifically today, we're going to look at that spillover effect in regard to health and wellness. So for those of you in the room who work on healthcare issues, I hope you see how what traditionally has been thought of as a workplace issue is actually yours as well. And for those of you working on labor and employment or work-family issues, I hope you meet some new friends and allies in the healthcare arena. So a few notes to start, so we're all working off the same baseline, and then I'll turn to our panel. Our definition at Workplace Flexibility 2010 of workplace flexibility includes 3 buckets of issues. Flexible work arrangements, which is about the scheduling of hours and the place of work. Time off, which includes paid and unpaid time off of varying lengths, short-term and long-term. And then career maintenance and reentry, which is really about when you think about the life course, in moments people may dip out of the workforce altogether, and how do they get back in or transition in a more graceful way than they can right now. So to date at my shop, just last week we issued a policy platform on that first bucket around flexible work arrangements, and I think you'll hear some about that issue today. But you'll also hear about time off policies and maybe career maintenance and reentry, although I sort of doubt it. But in any case, you'll hear a lot about those first 3 buckets. So I just wanted to make sure that we really are looking at flexibility in a really broad way. And I think the panelists are going to touch on different aspects of flexibility in their talks. Thank you so much. So now I will turn to our, very esteemed panel. Dr. Diane Halpern is professor of psychology at Claremont McKenna College and past president of the American Psychological Association. She's published over 350 articles, many books, a special 2-volume edited edition of Sex Differences in Cognitive Abilities, American Behavioral Scientists, and Changes at the Intersection of Work and Family. And I just, sort of to get my head in place last night, read one of her articles that was written several years ago. I just remember, I think it was one of the first articles to really talk about this connection between health and work and family.
Thank you very much. Thank you very much. I'm delighted to be here, and thank you all very, very much for coming this morning. I really appreciate the time you have your busy schedules. I think that Gwen and Kate have already set the stage for everything I'm going to say. really starting out with a definition of workplace flexibility. And it's really talking about it in a couple ways, but one involves arrangements for alternative times or places of working, examples of flexible start and stop times, working from home 1 or more days a week, compressed work weeks. There are really an endless number of possibilities. And then reduced work hours, and then the issue of compensation, of course, always comes up, and there's a variety of ways to negotiate it. Part-time employment, shared jobs, paid sick leave and vacation days. These are all topics that fall under workplace flexibility. Why do we need to be considering it now? Well, families have changed. We have large numbers of families with children under 18 headed by a single parent. I changed this number last night based on the latest data. We now have almost 40% of children born to a single parent, and that number is just rising, an incredible rise. About a third of families are in step families, and we have what's called the sandwich generation, where we have working adults caring both for their own children and for aging parents at the same time. I mean, there's been incredible changes in the nature of families. Also changes in the nature of how we work. It's been projected that about 85% of the workforce is going to be working parents. For the first time ever in history, since we've been collecting data, the number of working women is approximately equal to the number of working men, not because women have made great strides, but because of an incredible number of layoffs in male-dominated fields. Men are part of the changing workforce. Single fathers, increasing number. The number is 6%, but that number has been increasing. I want to make it clear that flexibility is not a woman's issue, and I'll present some data that show that it's important for men as it is for women. Americans are working more hours than people in any other country in the world. We passed Japan about a decade ago. Everyone says, what about Japan? I say you're 10 years behind. The highest number of working hours for those at the highest pay and at the lowest low-income levels, so that we have more. We are working more hours than any other country in the world. I have some references under there. That's how you know I'm an academic. Changing context. You know, the world is changing. Working parents are squeezed for time. I mean, you hear this all the time, but there are real benefits to having paid employment outside the home, real mental health benefits. So it's not as though, you know, the option of not working is better for one's mental health. There's self-esteem, reduced depression in people who work for paid employment. And the greatest gains are when the additional income moves families out of poverty. It's an we have to consider this in the context of our poverty legislation. And in fact, few families can afford to not have all the adults working. We often pretend, it's often as though choices involve luxuries, but in truth, our luxuries are things like health insurance, mortgage payments, and grocery bills. It is increasingly difficult for anyone to own a home, meet a mortgage, and meet the family expenses on a single wage earner family. That family has become a minority family type and seems to be going the way of the dodo bird. It's the only picture of a dodo bird I could find, but none of you will even know if it's good, because you've never seen one either. Work-life conflict has increased over the last 30 years, but the group it has increased the most for is men. Gender roles are changing, and they're changing very rapidly. And increasingly men are taking responsibility for caregiving, and they're the ones that are reporting the greatest increase in conflict. So I really want to make it clear that we're not talking about issues that are women's issues, but these are working family issues. We need really new models of work-life interaction. We need policies that help us manage our work obligations and our family obligations without asking anyone to choose between the two. And yes, those are beautiful children. I managed to slip them in somewhere. We know that workplace flexibility reduces stress, reduces burnout, and all the negative consequences that go with it, and those who have a number of indices show that in fact it's good for our health. I'm going to talk about one study because I only have such a short amount of time. It's one that I did. You might expect that's the one I'm going to talk about, but let me tell you that it has been replicated in various ways with other research. So it's really an example of how some of the research is done. Began with a national database of about 3,500 working adults, and they responded to one collected by the Family and Work Institute. And in fact, we looked at, they answered a variety of questions about work and family, and the hypothesis was that employees who have better control over their time will be healthier, they'll be happier, and they're going to be better workers. We hypothesized they'd have increased loyalty to their employer, reduced turnover, they'd work harder, and in fact, they would be healthier, and that healthier employees would translate directly into reduced health care costs. When I talk to employers, that's usually the first time their ears perk up. I'm sort of vague until I talk about that issue. Research findings, what did we find? It was one of those complex statistical models. I'll spare you, you'll be pleased. But the general findings are that we looked at those workers who have or don't have time-flexible work policies, full-time, part-time arrangements, start and stop time flexibility, ability to work from home, ability to take time off for a sick child. Those who reported they'd have no penalty for using flex options. A lot of places have them, but penalize people for using them. We found that among those working adults who have flexibility, they were absent from work fewer days. That's important. They reported fewer days being late or leaving work early. They said they were better able to meet their work deadlines, and they had reduced work-family conflict. We looked at minor health problems, a variety of symptoms. They reported less stress, less tired, reduced burnout. Burnout is actually sort of a technical term in the literature. They were more loyal to their employer, more likely to work harder than necessary. That's important for employers, less likely to change their employment, and had better work-related attitudes. But what can employers do to reduce time-related stressors for their employees and to enhance their profits? Well, many of them can have telecommuting, make it easier to take time off from work to care for family members, part-time options, sick leave, assistance with child and elder care. I've talked to plenty of employers who told me, great idea, but it won't work here. You know what? It can work anywhere. There's a whole range of options that are available, and some combination of flexibility has been tried with low-wage workers, with high-wage workers, and everyone in the middle, and there is some flexibility arrangement, and I'm happy to talk more about it later if anyone's interested in what some of them are. You never talk about this without a dollar sign, especially in this economy. And what are the return on investment estimates? Well, a rule of thumb is, and in most industries, about 4% of salary costs are due to absences. Days lost, times late, leaving early, doing family work in the middle of the day. If you assume an average employee of about $40,000 a year, 4% of that salary is $1,600. If we're able to reduce absences by 25%, and that is a modest estimate on what this will do, that's a saving of $400 per this employee at this level. If you look at turnover costs, you can look at percent turnover and costs associated with turnover that are reduced. The cost of coming late. Presenteeism is you're there physically, but you're not there mentally and emotionally because you're worried about a sick kid, you're worried about an elder parent that needs to make it to the doctor. And you also get a much better employee. Employees are much more loyal when they have these options. Okay, recommendations for public policies. Why should this be a public policy issue? Why is this the government's business? It's the government's business because it's what we are about. Everyone has parents, friends, neighbors who function as family, even if they don't have a traditional biological family. And everyone at some time will need care. These are universal issues. And we need to have sound public policies, ones that are consistent with our values and ones that are consistent with the bottom line. And flexibility is one way of achieving both. And we certainly, despite the number of changes in social policies, the number of changes in how we live and in the workplace policies have not caught up with the nature of changing families. We need to be aware of the complex linkages among work, education, wages, and poverty. You can't talk about one of these without talking about all of them. They are interlinked. If work arrangements allow parents to stay employed, it increases household income. It moves families out of poverty. Poverty is bad for kids. There is no doubt about that, lots of data on it. And programs that keep families above poverty are fiscally conservative. I try to use the term fiscally conservative liberally, so that I get a hold of everyone's attention. They help working adults upgrade their skills. We are facing a serious skill gap in the U.S. And in fact, we can help low-wage workers and others retool by allowing time for education. Family and medical leave is part of workplace flexibility. Families need medical leave. Ill family members miss medical appointments when there's no paid leave, often resulting in increased health care costs, prolonged illness, and ultimate loss of employment for a caregiver, and incredible stress. There's a large literature, and again, I'd be happy to provide references. Ill kids recover better when their parents are able to be with them when they're sick. Kids in burn units require less medication, are in less pain. I mean, there's a host of important health and issues that are involved when parents can take time off from work to take care of sick family members. Public policies, well, part of work and family involves having preschool available near public transportation, and an incredible number of benefits from high-quality preschool that reduces proportion attending college, reduces special education. I mean, these are all interconnected linkages, and it's almost like pulling a thread and everything starts to unravel, because workplace flexibility is related to health, physical health, mental health, employment, education, and our whole economy rests on their ability to keep families working. After-school programs are part of keeping people at work, keeping children safe, increasing physical exercise, and also plays a major role in the childhood obesity problem that we're facing. These are all of a single cloth. Aligning work and school calendars. Our summers off for schools are based on an old agrarian model. Few of us go out and work the fields in the summer, but we still have it, and we know that that is actually not good for especially low-income children who show incredible academic losses over the summer and create stress on working families. These are things that could be done with single public policy kinds of initiatives, and people in this room are the leaders in making all of this happen. We really need to recognize the benefits of combining work and family. It offers mutual benefits. After about 100 years of focusing on mental illness, psychologists is increasingly focusing on wellness, on happiness, on positive psychology. And we know the two factors that are important in keeping people happy are they're having meaningful work and close positive relationships. And clearly we need to be creating structures so that people don't have to choose between the two. Thank you very much.
Thank you so much. Dr. Joseph Brevach is a family scientist who is internationally recognized for his research on work and family and its implications for individual health and well-being. He currently directs an intensive research program focused on work, family, and health, funded by the Eunice Kennedy Shriver National Institute for Child Health and Development. Dr. Gribach has published several papers documenting the health-related implications of workplace flexibility, research productivity made possible by support from the Alfred B. Sloan Foundation, and he's actively involved in several national advisory panels focused on workplace flexibility. And I had the pleasure to meet the good doctor several years ago when several folks came together and were talking about the state of the literature and research in this particular arena. And it's great to see that you've done lots of work since then. So, off to you.
I'm going to do my best to slow down because Diane packed a lot of information into a short period of time. And so my goal is really pretty straightforward. I have 6 slides to deliver to you, but I want to start by putting those things in context. In a previous life, I managed a worksite health promotion program for about 1,800 employees across 2 different states. And I remember vivid kinds of pictures going through my mind of going, darn, we have this awesome fitness center. We have these amazing programs for helping people lead healthier lives. Why aren't they doing it? Now, just to give you a little insight into just how old I am, at the time, in the early 80s, I was just out of college, and I remember talking to one new mom. She said, Joe, I'd really, really like to go to the fitness center after work. But you know, I can't make it there on my lunch hour, and I just can't wait to get home to my baby. And I remember having the audacity to say, well, I guess it's just about your priorities. And I bring that story up because it's important. Because when I look at organizations such as those I used to work with, and frankly, to a certain degree, it still holds today, that is, worksite health promotion programs are frequently working at cross purposes with more human resources kinds of programs like work-life. And so part of my comment today, part of my take-home message, is that work-life, flexibility is one aspect of work-life, cannot be separated from an organization's attempts at health and productivity management. They go together, just as Diane was saying. So that's the context for just a moment. Now, because I'm an academic, we think in terms of models, and frankly, this is the typical view, right? Flexibility, of course, must be good for health. Now, the problem that comes in with answering that question, and frankly, it's something that we grappled with 4 years ago at this seminar panel that Katie was just referring to, is that both flexibility and health are kind of complicated topics. And so a more realistic picture, and this is sort of a fun slide, is that there's different kinds of flexibility. It's not a program. It's a management system that we use, and it can become manifest in a variety of different forms, in the form of location flexibility, such as can you telecommute, in the form of schedule control, such as do you have flex time or can you bend your hours at any given time, and then there's also career flexibility. And on the other side of the equation, health is a complicated thing. At a minimum, we can view health as having a physical domain and a mental domain. And at a minimum, we can view each of those domains of health in terms of morbidity. Do you have a disease? Do you have clinical depression? Do you have diabetes? But we can also think of it in terms of the subjective experience of those things, and that's what I have labeled up here as well-being. Do you have the physical stamina to do the things that you want to do, even though you may not have disease? Do you have the psychological well-being to be able to engage in your work, to engage in your family in a meaningful way, despite not having clinical depression or an anxiety disorder? And so all those bouncing sorts of arrows were to illustrate one main point, and that is to try to nail down the answer, does flexibility affect health? You have to be willing to accept the possibility, yes, maybe, sometimes no. Because health is a lot of different things, and flexibility is a lot of different things. And if we really want to answer the question, if we want to use flexibility as a strategic tool to get things accomplished, we need to think in terms of specificity, not in overarching models in a monolithic way. So that's the purpose of this particular slide, is that generally speaking, one of the things that you'll see in my presentation as well as in Diane's, is that flexibility is generally associated with better health outcomes. But it's unreasonable to use it as a tool for reducing healthcare costs today. It might be helpful for bringing healthcare costs down 10 years from now, but to reduce them today might be overly optimistic. We might be able to reduce absenteeism, such as Diane was talking about, because of the stress-related implications of work and family. But whether or not we can reduce the incidence of diabetes is probably questionable. Now this comes as no surprise to anybody in the room, right? But yet it requires to be said to make sure that we're all on the same page. So as I show you some of the data, because I'm an academic and I was required to bring data, it's important to consider that context. So these bars, these data, come from a very complex data source of essentially 35 major employers across the United States. The x-axis, the neither, flex time, compressed, or both, reflects individuals' engagement in one or both kinds of flexible work arrangements. The y-axis represents the amount of stress and burnout those folks have. And as you'd expect, I wish I had a pointer, but I don't. As you'd expect, those individuals who have flex time options generally have less stress and burnout. So that's the flex time only, the compressed only, and the both. But notice there's a difference. For men, it goes down, always, right? If you have flex time, you're better than not having things. If you have compressed, you're better still. And if you have both, you're better still. But notice for women, if you have flex time only, good. If you have compressed work weeks only, like working a 4-10 shift, good. But if you have both, golly, you're as bad off as those people who don't have either. Some people attribute that to sort of the supermom sort of syndrome, you know, so because you're flexible, you're trying to cram more things into the time that you have available, so therefore you're not really reducing the stress and burnout. And that goes back to the main point of viewing health in a more complicated fashion. Flexibility may help with some aspects of health, but it may have benign or potentially even negative effects in other aspects of health. And that's one of the things that I think that you see in this particular slide. This slide, the numbers are unimportant, so don't pay attention, because again, I'm an academic, and so I was expected to bring data. The point of this particular slide is simply to point out stars represent there's a statistically significant link. Okay, so that's what the stars. The point of this slide is to demonstrate that flexibility, whether you have stably high, continually high levels of flexibility, or if you've increased over a one-year term, this is predicting the likelihood of having a health decline. And so the point is that those people who have more flexible work arrangements, they're less likely to have a decline in their self-rated health. They're less likely to have new incidents of acid reflux disease. They're less likely to have an increase in stress-related symptoms. And they're also less likely to develop new cases of depression. But notice that it doesn't go across all the health outcomes. And again, that's important to remember. We can't expect, you know, in my early days in worksite health promotion, we promised the world. If you get your people exercising, you'll reduce healthcare costs, you'll have happier employees, you'll get all this great stuff. But you know what? Health takes time. We don't develop diabetes overnight, and we also don't get well, and it doesn't show up in visual indicators overnight. And so this makes sense. Now, because Diane was going to talk about dollars, I figured I had to talk about dollars. And I'm a little bit reticent to put this up in front of you, but I'm going to do it anyway because what the hecky Becky. So these are two theoretical units within a company. Okay. So now I recorded in the last table that the odds of having incident depression in a one-year time frame is about 30% lower in individuals who have flexibility relative to individuals who don't have flexibility. So these are two fictitious companies, each with 1,000 employees, each with 1,000 employees in them. The point is that you can see that the excess morbidity, that is cases of depression, is about 30. There's 33 additional cases, or fewer cases rather, in the high flexibility group relative to the no flexibility group. The National Alliance for Mental Health tells us that the average cost to treat depression in any given year is about $4,312. So that means in this fictitious case, I keep hitting that point, fictitious case, in this fictitious case, it cost Company A had an additional $143,000, $142,000 excess just in healthcare costs alone due to depression. Okay? So that helps give us an idea of what the magnitude of workplace inflexibility can be. So my punchlines, what do I want you to take home today? There's really a couple things. First of all, the available data suggests that flexibility is associated with less physical and mental morbidity. One of the things that I didn't show you, for the purposes of keeping this to 8 to 10 minutes, is that the mechanisms by which that occurs are entirely those that you'd expect. As Diane suggested, reduced stress is one of them. But also there's evidence indicating that people who have access to flexibility are more likely to engage in and sustain healthy lifestyle practices such as physical activity, good amounts of sleep, attending stress management programs, those kinds of things. And then lastly is the point I've already made, that is flexibility appears to lessen stress. Now to me, I'm pretty simple-minded. I'm a Polak from Stevens Point, Wisconsin. And so when it comes to the implications, to me, it's really pretty straightforward. The first one is that policies promoting workplace flexibility are indeed a viable leverage point for improving the health of the population. This is what the Work, Family, and Health Network, sponsored by the NACHD, is out there trying to figure out right now, is how can we make this happen in a systematic way that benefits both organizations and families. Second, it's important to recognize, though, that it's not a panacea. We are not going to solve the obesity epidemic in children today by implementing flexible work arrangements. We might be able to reduce the burden of the obesity epidemic in children over time via flexibility programs, but we're not going to solve it today. Likewise with other indicators of physical morbidity, mental morbidity, or other aspects of well-being. The panacea point I might point out is I wish I could claim that as my own, but in fact Kathleen Christensen made that point 25, 30 years ago. But I'll claim it today. Then the last one is that flexibility, and this is the point that I made at the very beginning when I was trying to lay the context for you. Unfortunately, all too often, worksite health promotion and human resources departments are working at cross purposes with one another. We think that flexibility is fundamentally a work-life issue or a human resource issue. I can tell you with data and with personal experience from managing a worksite health promotion program that flexibility is fundamental to the success of an effective worksite health promotion program. So to try to keep these two items separate is a mistake. And indeed, there's long-standing evidence and long-standing theory that says if you want an effective worksite health promotion program, you must have flexibility. And so I see worksite flexibility as fundamentally being a goal for both helping people integrate their work and family lives and for achieving goals with regarding health and well-being. Thank you.
And now we're going to shift gears a little. We had asked Dr. Halpern and Dr. Drivach to speak for a little longer since we don't get to see them as much inside DC. But now I'm going to introduce someone that might be familiar. David Gray is director of the Workforce and Family Program at the New America Foundation. And one thing he did, working with some colleagues there, is actually look more generally and across a lot of different researchers' data to surface some of the connections between health and workplace flexibility. So we've asked David just to essentially do kind of a cleanup in a sense of if there were any major points missing or kind of big picture points that might have been picked up in other researchers' data. So the turn to you.
Thanks, Katie. Thank you all for being here, and it's great to be with the American Psychological Association and Workplace Flexibility 2010, a great partner and leader on these issues. At New America, we're proud to be part of the Sloan Network in part because we feel very strongly about the impact that workplace policy has on families. And when we started to look at the data that showed that parents were perhaps working much harder than they did a generation ago, we've already heard a bit about that, but that they were actually not spending less time with children, we started to wonder what was behind that data. And it seemed to be that parents, while working much harder with two parents in the workforce, but spending a significant amount of time with kids, that something had to be giving. And what that was perhaps less quality time with kids and more distracted time, and then less individual time for health and well-being of the parent. And that started to cause us, as Katie said, to look across the board at, well, what would be the implications to caregivers, to parents, if they were being very distracted in their time with their kids and if they had less time for themselves. I think the impact on kids is one thing that's significant. Shane mentioned it, the Family and Work Institute has done some great research on how children, I think, view and are affected by the parents' distraction and lack of focus and quality time. We can go into it, I won't go into it now as she might. As we've already heard, there's a significant impact across the board on how workers feel like their work-life balance is not being what it should be and what they'd like it to be. And we can talk about that more as well later, but just to underline the points that have already been made around how workers generally feel that they are stressed. But as Katie mentioned, we started with this premise of looking across the board at the health outcomes of the lack of flexibility. And I'm going to focus a little more on mental health today, but I just wanted to bring in a point that Joe mentioned, really 2 points. One is that super mom point, that parents in some cases are trying to do it all. And then secondly, that there may be some real physical health implications, such as dealing with obesity, to a lack of flexibility. So the fact that over the same generation as you see this increase in work-life imbalance is the same generation where obesity is increasing. I do think there's some significant causal links to the lack of time parents are spending eating with their children, the rapid rise in consumption of fast food, the decrease in the amount of time families are spending eating together, and an increase in obesity. But one of the things that we started to look at in terms of our report, and we've got a broader report on the health implications of a lack of flexibility on the New America website, is that there are real mental health implications. And it wasn't necessarily around the number of hours worked as much as we found a lack of flexibility or control over how workers spend their time. So for instance, when we start to look at the impacts in terms of mental health, parents who report stress from the spillover of their work onto their family life are 2.5 times more likely to suffer from an anxiety disorder and twice as likely to suffer from substance abuse disorders than parents who do not report such stress. We found just frankly just a ton of great secondary research which we put into the primary research, which then we pulled together into our paper as a way to sort of summarize a lot of the health implications to a lack of flexibility. Parents reporting spillover from family to work were 30 times more likely to suffer from a mood disorder and 10 times more likely to have a substance dependence disorder than parents who were able to balance work and life and did not have such spillover. The most harmful cases of job stress we found were not simply a function, again, of time on the job, but rather of the relationship between job and flexibility. One study comparing parents and children's emotional states before and after parents return home found that working mothers transmit a significant portion of anxiety from work to their children as they return home. The mother or parent's emotional state had a larger influence on the children than the children's own emotional state just before the parents' return. And 2 studies found that maternal stress translates directly into mother-child conflict and behavior problems among children. Those internalizing behaviors and having increased aggression, in many cases, were found from the parents bringing home the stress of work to their household. This is a particular problem for, I think, shift work or a lack of or non-standard hours. One extensive review of the literature found that irregular hours led to behavioral problems and poor school outcomes in children, particularly due to the detrimental effects on the health of the parent-child relationships and the parent's own mental health. We also found studies indicating the decline in family routines, again, as I mentioned, around the decrease in parents and children eating dinner together, often associated again with irregular work hours, had harmful effects on child outcomes ranging from increased child anxiety levels, again, to obesity, to poorer school performance. And one study found that controlling for other socio-demographic characteristics, a lack of flexible work by one or more parents increases the likelihood of problem behaviors among children, and that half or more of the impact was due to a decline in parenting quality and parents' own mental health. The connect between stressful work and a lack of control over work schedules leads to other mental health challenges as well. So generally, as the number of parents and percentage of households with 2 parents working outside the home increases over the last generation, as we've already heard, the stress that families are facing appears from this mismatch between the needs of families and the structure of work. And that it really has a lot to do, not just with the amount of hours that workers are spending on the job, although I think that is a significant issue, but really comes down to the lack of control and the lack of flexibility. And the more we try to figure out, parents are working harder than ever, spending time with children, what are they giving up? They really are giving up, in many cases, their own mental health and their own physical well-being. And we can't just say, well, then the parents are going to be able to just isolate that in themselves, and that will have no impact on their family life, their work life, or their children's life. As we already heard, it has real impacts on the quality of one's work, and an increase in absenteeism, and a lack of ability to do the quality work when the workers are stressed. But we also found in a number of studies, both physical and mental implications, and implications for the children themselves, when the parents didn't have flexibility and were stressed. So it's not just a negative impact on parents from a lack of flexibility, it then spills over and has real physical and mental implications for children. And so the implication for this policy-wise for us was that we needed to find ways to reduce that stress, that spillover work and family, and that was found mostly in a control over hours. The ability to have increased flexibility in the workplace was, we found, that the best way to try to mitigate some of the mental and physical detrimental impacts of the mismatch between work and family. Thanks very much.
Thank you. Great. And now, thank you so much for that sum up. Now we're going to turn, we thought, it is important. We've heard about some business impacts of the intersection of these two issues. But we thought it would be helpful to bring in some folks who could speak to both business writ large. And Dr. Shani Peer is Senior Associate at Families and Work Institute. And she spends her time, her day-to-day job, focusing on the work-life program area as a project manager for When Work Works, a national initiative on workplace effectiveness and flexibility. In that capacity, she works to inform and engage employers and community leaders, share research, develop educational materials, and increase public awareness about new ways to make work work for today's employers and employees, as well as for the families and communities that sustain them. And so she'll just give us a bit of an overview on what is happening in businesses in this area, and then we'll turn to Don Kemper to get real specific on the company that he runs.
Thanks very much, Katie. It's really a pleasure to be here this morning. Thank you for inviting me. We've already heard a lot of the really great research and data about the impacts of flexibility on mental health and physical health and well-being. I'm actually a former academic, so I know that we have data, but I'm not going to tell you about it. I just want to add that Families and Work Institute does do studies both of employers and employees. We conduct a national study of employers every 3 years. And I brought some copies that are outside if you want to pick up a copy of this study. It looks at the programs, practices, and benefits of employers and provides a good representative sample of what employers are doing to provide flexibility. And this study can tell you, for example, what percentage of employers offer different kinds of flexibility, what kinds of flexibility are most prevalent, whether there are differences between large and small employers. The short answer is not really very many anymore. We also can tell you in this study how many employers offer health insurance and how many offer wellness programs. It's about 51% overall, more prevalent among large employers than among small employers. We also conducted a national study of the changing workforce, and we have new data from 2008. And there are some sheets that were also on the table outside that share some of the highlights from that data that aren't actually public yet. You've already heard about the increase in work-family conflict. It's actually higher among men than among women. That point was already made. And employed parents say they're experiencing a time famine. It's going up. 75% of employed parents today say they don't have enough time with their kids. Slightly less say they don't have enough time with their spouses or for themselves. So that's some of the data that we have. We also have found that employees who have a good work-life fit, and we've looked at 5 different factors that contribute to work-life fit, do have much more positive outcomes in terms of good mental health, overall health, and stress, lower stress levels. So all of that information is on the tables on your way, that you can pick up on your way out. But what I was asked to talk about today is more to provide some concrete examples of what, that may be my phone. Sorry. This is an example of work-family conflict. Okay. No, it's actually work. Sorry about that. No one told us to turn off our cell phones. Anyway, so
tell a group of Hill staff to turn off their cell phones.
So what I was asked to talk about and to focus my remarks on is some concrete examples of what employers are doing to promote both physical and mental health and wellness among their employees. And I'm going to be drawing on examples of employers that are winners of the Alfred P. Sloan Awards for Business Excellence and Workplace Flexibility. This is a national employer awards program that is managed by Families and Work Institute in partnership with the Institute for Competitive Workforce and the Twigga Foundation. We have a couple examples of guides that describe the practices of our Sloan Award winners. We'll have a new guide coming out soon, so if you'd like for me to send a copy of that guide to you, please let me know. And so my examples will be taken from these Sloan Award winning companies. And I just want to point out, before talking about wellness initiatives in particular, I just want to point out that these Sloan Award winning companies really underline and illustrate much of what we've already heard today, and that is that having a flexible workplace and having a flexible work culture in and of itself already has positive outcomes on employees and on their mental and physical health. Employer after employer among these Sloan Award winning companies talks about how the flexibility that they offer results in having employees who are happier, who are more healthy, more productive, feel less stressed at work, more able to focus on their jobs, employees who have peace of mind because they don't feel like they have to choose between work and family. So flexibility in and of itself is already something that provides very good outcomes. In terms of programs or initiatives that focus on promoting health and wellness and employee well-being, I wanted to provide some examples. And most of these examples actually focus on promoting health and wellness more broadly rather than focusing specifically on mental health. Some of them do talk about stress management and offer things like yoga and on-site massage therapy to address levels of stress. Many employers appear to define wellness rather broadly and holistically to include mental health. And I think many of the other initiatives that focus on fitness, on nutrition, on exercise, weight loss, offering classes like Pilates and yoga and Tai Chi, those may have impacts on physical health and fitness, but they also have impact on mental health as well. So just a couple examples from our Sloan Award winners. I'll start with Discovery Communications, which is a global media company in Silver Spring, Maryland, with almost 2,000 employees. And this company offers employees a broad range of flexible options to help them meet their obligations in and outside the office, including compressed work weeks, part-time roles, job sharing, the ability to take a leave and to come back again. They have an on-site childcare. These are some of the examples of their initiatives. And they also opened in 2004 an on-site medical clinic that offers holistic health management with stress busters like massage therapy, yoga, meditation, stress management workshops, aerobics, nutrition counseling, and on-site reflexology and life coaching. All of these are available by appointment. And Joe made the point that it's difficult because flexibility is so complex and because health is very complex. It's difficult to know whether there are actual impacts in terms of reducing healthcare costs or having measurable outcomes on specific health issues. But Discovery Communications, for example, says that since opening their center 5 years ago, it has helped them save more than one life and has also saved the company an impressive $5 million. And they base this on health insurance cost savings and reduced staff time away from work. Discovery even offers bicycle and sneaker reimbursements. So one very creative way of encouraging people to bike and walk to work. Another example, and the Sloan Award is offered to employers of all sizes, so I picked a couple of different types and sizes of companies to provide as examples. The Metropolitan Milwaukee Association of Commerce, which is a nonprofit in Milwaukee with 37 employees, also provides a great deal of flexibility in when and where work gets done. And the COO, Mary Powers, says that employees have maintained a strong work ethic and seem happier and less stressed, in part as a result of a health program that has helped them ease stress, lose weight, and generally adopt healthier habits. And in fact, here again, they actually provide data about the impact. The group's top 3 health risks, nutrition, fitness, and cancer, decreased by 5%, 3%, and 11% respectively in just 1 year after they introduced this program. They have a wellness program that includes a yearly health risk appraisal for employees and spouses, annual biometric testing and flu shots in the office, health counselors that provide individualized health risk reduction services, and access to a website with a wealth of health-related information, including comparisons of local physicians and hospitals, for example. A third example is World at Work, which is a not-for-profit association for compensation, benefits, and human resources professionals in Chandler, Arizona, with 150 employees, and they also won an award from the American Psychological Association for having a healthy workplace. They provide access to a privacy room, chair massages, seminars, fitness assessments, and control over a schedule that keep people engaged. But they also provide what they call a culture of wellness at work and flexibility that reinforces to each employee that their work-life effectiveness really matters. And we have fully 66% of employees who participate in their wellness program that encompasses individual and group coaching, weight management, wellness days, lunchtime seminars. They offer weekly on-site yoga and strength conditioning classes, a Fruit of the Month club, support groups and educational meetings. They have EAP services, a 24-hour health line, annual voluntary health assessments that cover basic blood work, cholesterol checks, fitness tests, and wellness goals. They actually pay participants $20 in cash to participate, and they get a confidential results sheet. They provide on-site flu and pneumonia vaccinations. We've seen that in a number of other employers. But this is the only one that I heard about that actually provides mammograms during the workday in a mobile lot in the parking lot, a mobile lab in the parking lot. So a creative example of ways of bringing basic healthcare services to employees where they work. The results, again, they've documented results. Employees have decreased body mass by 2%, cholesterol levels by 11%, blood pressure by 5%, glucose by 11%, and they also find that these wellness programs reduce absenteeism, improve morale, keep turnover low, all the kinds of results that we've already heard about. So I think that, I could add to the list. I think that you've heard a lot of the examples. Other employers offer massage therapy, stress management, health club memberships. We have wellness centers, wellness committees, wellness coaches, wellness days, and wellness fairs, walking programs, running programs, weight loss competitions, the list goes on. But I think to the question of what can employers do, or can employers do anything about this, there are hundreds and hundreds of examples among these employers, and many of them have really documented the results. So now we're going to hear more specifically from one of the Sloan Award winners, which is Healthwise in Boise, Idaho, and he can drill down even more and tell us what his company provides. Thanks so much.
Thank you so much.
Good. Well, my stress level went up a little when Shani unplugged the computer and turned it off. So I'm wondering if we can test the Katie Corrigan standard for workplace management. If you could set it up while I start.
Do you want to put it up? Or
if you could,
yeah,
that would be great.
Good.
But I'll start without it, if that's okay. So Healthwise is a not-for-profit organization in Boise by God, Idaho. And I'm here really not as an expert, but speaking as an employer. So Healthwise actually does work on health issues, but we're here today to talk about health. Our mission is to help people make better health decisions. So it's mostly about, do you need this test, do you need this drug, do you need this surgery? But early on in our history, we built in some basic principles to our work culture. So we were founded in 1975, so we've been around a long time. And a couple of decades ago, we came up with these 3 simple elements of our culture. The first is, well, it's respect, teamwork, and do the right thing. Pretty simple. Respect is, you don't have to earn respect at Healthwise. It's a gift. And you give it to each other. And you give it to your suppliers, and you give it to your clients. So respect is a big deal, and it's just become the norm at Healthwise. Second thing is teamwork. So we really put an emphasis, and in your performance review, we will value you based on whether you've helped others reach their goals just as much as whether you've made your own goals, and whether you've helped other teams just as you've helped your own team. And then the third thing is sort of the catch-all for everything. It's do the right thing. So we train our supervisors, our team leaders, to encourage people to use their own judgment and to do what they think is right for a client or for a coworker or even for themselves, and we'll back them up because we think there's always far more good to come than harm from people trying to make that judgment for themselves. So if this is making me feel better, it's coming up nicely. So those three great things. Those three principles really undermine, or not undermine, they underlie all of the basic elements that have allowed us to be honored by some of these organizations. We have won the Sloan Award, and we have won the American Psychological Association's Workplace Flexibility Award. And even the Wall Street Journal named us as one of the 15 best small workplaces in the country. And it's not because we've really tried to win awards. It's simply because these principles have guided us to doing these things. So there are some secret sauce elements to it, though. So we use symbols. We do have a wellness program. And if you look, you'll find workplace flexibility throughout the kinds of things that we do for our employees. So in terms of symbols, we think it's important not to just have these principles, but to show them off. So we try to do things that are very visible, that remind people of this culture. The biggest one is Connie Cook is our receptionist. You walk in the door, Connie will make you feel that you belong at Healthwise. Whether you're an employee or a worker or whatever. So, you know, so many organizations have to move to automated receptionists, etc. We think this is a real important part of the wellness in the building. We also have bikes in the lobby. You can take and go off to lunch or go off on a ride. Just, it's a symbol. You walk in and you say, ooh, this place is different. We have a nap room. You need a break? Okay, you can go take a nap. Yeah. Or you can just get away and think. Or you can work at a workstation with a computer and everything. Or you take conference calls on a treadmill. We've got a hammock. We've got walking trails right out the back door. It's a nice place. Even our art is symbolic. All right, so this is an Inukshuk. Anybody know what an Inukshuk is? All right, it's art from the Alaska Natives, and it's going to be the symbol of the Vancouver Olympics. It's usually something that's put out on the tundra to point the way to home or to good hunting grounds or fishing or whatever. In our case, it's pointing the way to good health information, and it's big and bold and right out in front of our complex. Wellness is also a big deal for us, so we have our own fitness facilities, we have our own showers, we have yoga classes come into the building, we have massage therapists come in periodically, not every day. We have a wellness day, which we really devote most of the day to our own personal health advancement. People set their own personal health goals. We have a Wellness Bucks program that helps pay people to work on their goals throughout the year, and to sometimes using creating teammates so that you can check on each other or encourage each other, support each other as you go forward. We have, this is the best thing since kindergarten, we have a healthy snack program that we all come together once a week on a Wednesday afternoon to have a healthy snack and just cross-team connections. So flexibility, we never really set out to be a flexible workplace, but I liked the definition that came to us this morning in the packet, that it's hours, it's the ability to have career flexibility and to have these unexpected, ongoing personal and family need flexibility. We do all that, but it's really been a byproduct of doing the right thing. What we've tried to do is to say we want employees who are good people. And how can you be a good person if you miss your son's soccer game, or if your child's sick and you can't take care of them, or if your father's in the hospital and you can't be supportive? And so we've just used our strength in teamwork to allow that personal flexibility. When people need to go, they go. And the team takes care of that to help each other. And that's really worked well for us. So we do have a dress code. It's not quite this casual, but people wear what they want. They do have to wear something. All right. We have dogs at the workplace. Any given day, we'll have about 30 dogs. We have 220 employees, and a lot of them have dogs. And you know, the people come first. Dogs come second, but it adds to the workplace. We even allow children. They're a little less. You know, they're a little more disruptive than the dogs, but they come from time to time, and they're welcome as well. So people really, well, we also measure our culture. So twice a year, we have a survey. Ask all employees to complete this survey that measures their satisfaction with the organization, with their team, with some of the basic principles, respect, etc. How's your work-life balance? How respected do you feel? The key thing is that this is anonymous. Okay, so we're asking people anonymously to respond to this. And it's really only for the thick skin, because when you get an anonymous response, you really hear all the dirt that's going on. I mean, you got to be tough to get this response. But it's also, just if you really want to improve, you need to find these things out. And what we learn is that the hot spots in the organization move around from team to team to team. And that if you can know that, you can get feedback on it, and then focus in those areas and solve the issues, you really can bring people back to a very positive sense. So on a scale of 1 to 10, our last review, the average response for overall satisfaction was 8.3, which is pretty darn high. We have a lot of ones in there, mixed in, but not too many. And that just shows, it shines a spotlight on where there's an issue that we need to go and work with and try to find a resolution. We get 97% participation in these anonymous surveys. We don't know who that other 3% is. I'd like to find out. So people ask, how can you afford to do all this? And the answers are, Diane talked to it a lot about how you get lower turnover. That's a big savings for us. You get a lower use of sick leave. We get about half of our sick leave is used each year. You get a lower healthcare cost. This year, our healthcare cost went down, not up. And it's because people are being self-responsible. We get about 100 applications for every new position that we offer. So, this year it's probably more. Okay, but that's not the reason we do it. Those are some of the side benefits. The reason you do it is because people want to come to work. And they want to come to work, they're there mentally, physically, they're more creative, and it's more exciting for them to be there. That's why we've been able to, of the 10 largest health plans in the country, all 10 get their information from HealthWise. The 3 largest disease management companies get their information from us. We have many of the big portals, WebMD and Yahoo and MSN, all rely on information written in Boise, Idaho, to help people make better health decisions. So, a lot of hospitals do. So about 120 million times a year, people are doing our mission of helping people make better health decisions by using the information we've created. I don't think that's happenstance. I don't think it's not related to the culture of the workplace. I think it's our culture that has allowed us to succeed at that level across the country. So that's exciting for us. And then I want to end with just a few recommendations for the policy folks here in the room. We really like the Family Medical Leave Act. Keep it. If you're going to expand it, great. Go easy on the reporting, especially for us small organizations. But it's a great thing, and it really helps. In healthcare reform, anybody in the room working on healthcare reform these days? Good. All right. I want you to hear this and advocate for this. The biggest untapped resource in healthcare is the patient, is the consumer. And But none of the folks working on healthcare reform are really focused there. So look at that. We have 3 rules. The self-care rule: help people do as much for themselves as they can by giving them the tools that allow them to do more. We do it in every other aspect of our lives these days. We're our own bankers, our own travel agents. We design our own websites, we do our own movies because we've been given the tools. Let's give people the tools to do more for themselves. The guidelines rule: help people ask for the care they need by giving them the same guidelines that their clinicians should be using. And it's easy to do. And then the third thing is the veto rule: help people say no to care that's not going to improve their lives. We can do those things. We can give enough flexibility into health care that the crises can be solved. And then the final thing is this Medicare reform recommendation. There is something called mymedicare.gov. It's pretty poor. It's pretty ignored. Pump it up. It can be the same quality of support for elders and their caregivers as some of the really good websites that health plans have developed. So do that. And also expand the concept of hospice. Let people really learn how they can bring quality to the last years of their lives far better than what we do when we put them into the river of care in our facilities. So that's my soapbox. And thank you very much. I've really enjoyed being here.
Thanks. So we have about 10 minutes left for Q&A. We heard a lot of information from a lot of different people. I'm sure they're all glad to follow up with you offline as well. But if you have any questions you'd like to pose in these final minutes together, that would be great. Yes, in the back. And if you could just say your name and where you're from, too, when you say questions, so in the back.
Hi, my name is Michael Rose. I'm a reporter with BNA. This is really for anyone on the panel, but it seems like most of the workplaces that you've talked about today have been basically people who work in offices. And I am sort of interested in hearing perspectives on, have any sort of innovative workplace programs been implemented in non-office workplace settings, factories, construction, other non-white collar industries, and how can you sort of adapt programs like the ones you've talked about to that sort of setting?
I'll just get started, and I think I'm loud enough. Won't be a problem. I'm loud. There's lots of, it's been implemented everywhere. People who work on automated lines, for example, flexibility has worked by allowing them to complete a whole project, so then they could work on their project without having that kind of need for people further down the line. It's been worked with low-wage workers in hospital settings, people who clean our in hotels, hotel room people, where they're able to do their work scheduling online, and their responsibility, they switch, they cover for each other and allow them to set schedules as long as they're certain that the entire schedule is covered. It's been used with restaurant workers. There's an entire range of a flexible workplace for low-wage earners, and I'll be happy to give you some references with specific examples.
If you're interested, we have in the back of this bowl I just got, there's an index by type of company, and lots of different types of companies. There are some that you see more often than others. They tend to be professional service companies. There are law firms, accounting firms, financial services firms, architecture firms. Many examples actually of medical services. They've been really creative about being flexible. Banks, a number of nonprofits. We haven't seen, at least in terms of the Stoneworks, we haven't seen as many manufacturers apply, and not as many sort of service providers like hotels and restaurants. I think it's a little bit more challenging for those kinds of companies to figure out how to provide flexibility. But there are a lot of good examples of doing that, and for low-wage workers in particular. One of the things that we found is that if you can't necessarily, for some kinds of jobs, you can't offer some kinds of flexibility, right? Or if you have shift work, or if you have someone who has to be behind a hotel desk at a certain time, or working in a restaurant, they can't telecommute, and they can't call up and say, I'll be there in 5 hours, but I'll work later tonight. You know, there are certain parameters around those jobs. But for low-wage workers in particular, one thing that's really important is giving predictability and control over their schedules. So if you allow people to have some predictability and to choose the shifts that work best for them, that is a huge plus for them. If someone's working in a hotel and they have young children or some other people to care for, and their schedule changes every week, that's a huge headache in terms of childcare issues. So predictability, some control over scheduling goes a long way for certain kinds of jobs where you can't offer other kinds of flexibility.
And just one quick note, Corporate Voices for Working Families came out with a report just last week or 2 weeks ago on companies that employ lower wage and hourly workers and flexibility. So they actually have some very specific examples in there.
And I was just going to tack onto that I think the fundamental issue, because I do a fair amount of research like with immigrant farm workers and immigrants working in the poultry processing plants and that sort of thing, and the fundamental issue is being able to redefine what flexibility is. For a long time, flexibility was viewed as flex time, and that's the only thing that was flexibility. I think the point that needs to be made, that needs to be reinforced, is that if you consider flexibility broadly in terms of their career or their job, and in terms of the time of day and in where they do their work, in that entire mosaic, if you will, of flexible options, each employer can likely find something. Now, some of it usually ends up falling in the realm of what Shani was talking about, and that is we have to be willing to give up some control and put it in the hands of the workers. And particularly with low-wage workers, that seems to be the biggest challenge, is that there's a reluctance to put it in the hands of the workers. And I say that provides a concrete platform for thinking about health disparities in this country. That is, the best jobs go to the people who are generally affluent, generally white, generally well-educated, but those people who are working on the construction line, working in the poultry processing plants, working in cleaning the streets and that sort of thing, they're usually not given that discretion to be able to say, you know what, my son has a soccer game too that I'd really like to go to. So I think that's the biggest issue for a lot of the low-wage kinds of jobs.
And there was a question here. You have the mic.
Oh yeah. It's we've been talking
I'm sorry,
about.
Could you just say your name?
Oh yes. I'm Rachel Hermes-Levine from the National Institutes of Health. Those of us who are in the federal workforce will soon probably be tasked with improving the health of our employees, which is luckily something we already do. But we're specifically tasked with improving health regardless of employee rank, level of influence, GS. And so I would be interested in successful best practices, because I can offer yoga, massage therapy till the cows come home, but my GS2s and 3s will not be there, nor do they have the permission to be there, for example. And another striking example is something that we just offered to boost morale. We had an Italian ice cart there, healthy food offerings. People were thrilled. But the thing that my colleague Angela and I heard from more than one person was like, you didn't do this on payday. You didn't do this on payday. We can't even join you, offer it on Friday. So to give examples of best practices that would remove some of these disparities would be very helpful.
I can't speak with regard to best practices because I'm not in practice. But this takes me back to in the days when I used to teach worksite health promotion kinds of classes, and that is the typical model has been, and I don't know if it still is today, that essentially it's the great white doctor from the north sweeping in, delivering a lifestyle like they want. We don't take the time to figure out what are the issues, the barriers, the circumstances that stand in the way of people participating in the great program offerings that we're trying to do. So for a long time, community health promotion has been real smart, right? They've developed these great models that say, before you ever even implement, you need to see to it that you talk to key stakeholders from across the organization or from throughout the community to make sure that you identify and create a program that has equal access to it. And this sounds a lot like that ongoing sort of issue, so it suggests to me that we really haven't gotten over that as far as worksite health promotion is concerned.
It's I think here and then in the back. So.
Hi, my name is Carol Boyer, and I work for the U.S. Department of Labor, Office of Disability Employment Policy. And I really enjoyed all of your talks. I'm really amazed that some of these companies have such small employees but get so much productivity. I was very glad that you mentioned the number of employees you have. found that was great. One of the things that I wanted to comment for all of you that are interested in workplace flexibility is what ODEP, the Office of Disability Employment Policy, has had 6 or more years of a strategy that we had numerous demonstration projects on, and it's a growing workplace flexibility strategy called customized employment. Even Deloitte has coined, or I should say trademarked, their mass career customization. And just like Deloitte did to address the issues of their women executives that were leaving their workforce to have children because they were there for 10 years or more and they were losing that archival and knowledge and experience that they had, they decided to address that by doing career profiles where people could bump up and work at the pace they want or not work at the pace they want. So they found that that was a great strategy to apply to the entire workforce. So what they did for women was applied to their entire workforce. What we want to posit is that what we have done to help people with significant disabilities become employed at above minimum wage is a strategy that can work for people of all complex needs, from single parents to returning veterans and returning service members, to people with limited English proficiency, to ex-offenders that need to be at work. And so it's not just flexi work, flexi place, and flexi time, it's flexibility around the job tasks, to look at what people can do, what abilities, skills, and experiences they can bring to the workforce, and it's also a great retention tool as well. And I do want to say that we did get noted in the top 20% of the Harvard Innovations in American Government Awards, as they saw that as a very effective best practice. So we have research-based evidence that customized employment does work, and we want to apply that to the generic workforce.
That's great. And I think we're going to just have time for one last question. I saw your hand up.
Good morning. My name is Harriet Taylor, and I'm from Altarm Institute. We're a health research organization. And I have a question, if anybody has done any research on this American work culture that we, I'm a social worker by training, that we tend to foster in our children even at an early age, say kindergarten. What are you going to do when you grow up? And I'm wondering if that kind of philosophy, that American philosophy, where a 12-hour workday is not a horrible thing, has anybody done any research on that? Why that is versus, let's say, European countries, where the expression I often hear when I'm abroad, Americans work to live, where the rest of the world lives to work. Or wait, the other way around. So I'm wondering if anybody has even done any research, gathered any data about that philosophy.
I'm looking down at families and work right
I'll tackle it just briefly. There's been a lot of research on that work culture and work orientation and work motivation. And I guess it really depends on to whom you're comparing us. Certainly the most recent work I'm thinking about came out of China, and the very early orientation to work and achievement and to work as part of the greater good. And there are definitely cultural differences in how we view work. If you listen to any lawyers talk about, I worked through Christmas Eve, I put in a 26-hour day, I mean, it becomes a brag status. And there's no doubt that there are important differences. I also know, and I've spoken to perhaps a more conservative group than some of my colleagues, because I would never use terms like on-site reflexology or a fruit of the month club day. I mean, so I'm much more careful, depending on the audience. But not everyone thinks that's a bad thing. And when you bring up some of the European culture, they said, well, that's why we're exceeding at a higher rate. We're not. Our economy is not tied to that kind of ethic. But the belief is that this is a good thing. So it's really tied with a value system and a whole range of issues, but definite cultural differences.
Yeah, I just want to add to that. They haven't done a lot of research on why there are differences, but there's certainly, I just want to underline that certainly there are enormous differences between the United States and Europe and the rest of the world on most of these public policy issues. Not only do we work hard, and Jody Heyman at Harvard actually did a broad international study looking at 177 countries, comparing what they do in terms of what they offer in terms of maternity leave and sick leave and a whole range of things. The United States is one of only 4 countries in that survey out of 177 that doesn't offer paid maternity leave. The others are Swaziland, Papua New Guinea, and we're in a very small minority of countries that don't offer sick leave. We have less paid vacation than just about anyone else. So the differences are enormous. I don't know as much about why there are differences. We certainly do have a strong work ethic, and I think we have a lot, tend to have a lot more of a view of family as being a private issue rather than a public issue, and more of a reluctance to have public policies intervening in the sphere of the family and of parenting. And so I think that explains part of it, but not all of it.
Great, and I'm going to give Dr. Joe the last word.
I promise it'll only be no more than a minute and a half. In some ways it's going to be the minority report, but I think it's important to hear the minority report in a conversation like this. I mean, because I think the fundamental issue that you're raising goes to a core American value. That is one that you pull yourself up by your bootstraps. And one way to pull yourself up by your bootstraps is to work harder. Now, whether or not that's true is an entirely different issue, but it's a long-held cultural belief that you pull yourself up by your bootstraps. And I think it's important to recognize that while there's lots of really great ideas, it's also important to recognize that there's huge infrastructural things that stand in the way of those good ideas. So I would love to see flexibility on the poultry processing line, right? But it would require an entire redo, in some cases, for some kinds of flexibility, of how that building is constructed. That costs money. And I don't know about you, but I like my $1.49 pound chicken. I don't want to have to pay $2.49 for that pound of chicken. Okay? So while I wholeheartedly advocate for various kinds of flexible work alternatives, it is important to recognize that we have an entire institution and infrastructure that's built around one model of getting work done, and that is the 40-hour work week where a man or a woman is a cog in the machine. And to change all of that is going to take time, energy, and some patience.
And I think that's a good place to end. Thank you so much for coming. All of us here obviously are open to further questions up front or via email. And I think just ending on that, that's what we're all here about, trying to change the way work gets done, making flexibility the norm. Our report's out front along with a bunch of other materials. Thank you. Thank you.